The omega is the anterolateral portion of the alpha plate and is part 2 of a 3-part series. The omega incorporates the second bend of the alpha plate, which supersedes traditional humeral plating by combining an anterolateral plate with a proximal humeral plate.
Traditionally, plates that are applied to the proximal humerus are straight plates, and as one is required to extend distally, if you imagine this plate continuing onto the humeral shaft, one would be required to release most, if not all, of the deltoid insertion, and therefore affect the patient's postoperative recovery, as well as stripping the bone of soft tissue attachments which provide its vasculature.
The unique features of the omega, or the anterolateral portion of the alpha plate, include allowing plate to sit on the anterolateral border of the humerus.
Further distally, the plate takes another bend. Not only does it do this in order to avoid the entirety of the deltoid insertion, but also to allow it to sit on the anterolateral border of the humerus, which is more consistent with the extensile approach that one would take to fix a fracture of this complexity.
The secondary distal contour creates an optimal structure for fractures with shaft extension. It also avoids the lateral structures in the distal humerus.
The fact that this plate turns into an anterolateral plate for the humeral shaft also allows one to avoid the lateral structures in the distal humerus, most notably the radial nerve and the musculature associated with the mobile wad, again allowing us to preserve soft tissue structures and attachments to the bone. This plate then follows the normal anatomic contours of the humerus and allows one essentially to plate laterally proximally, but anterolaterally distally.
Lastly, the complexity of the design does not reflect or change the simplicity of the technique or the standard familiar surgical approach.
The actual technique for fixing these fractures hasn't changed at all. So it's a very familiar technique. It's just that we've created a plate that more closely follows the design of the bone, so to speak. The anatomy of the bone is more closely followed by this plate, and therefore it really just facilitates a technique that surgeons are already familiar with.